Hey, Dr. Kelly Starrett here, talking about safe use and more effective use with the TimTam. When we see high velocity percussion, most of the time people intuitively understand how to use the device. They are going to put it on something that hurts or in something that feels like it's a restricted area, so a tissue that may be stiff or not functioning well. One of the things we want to remind our users, our athletes, is that your muscular system, when we're addressing at a muscular level, is a component of a system that involves your brain and your muscles. We call it the neuromuscular system. And it's important to understand that if I just pull on that or push on that but don't have my brain involved, sure, I may make changes within the connective tissue of the muscular system, but I'm not going to make wholesale changes in how well that muscular system or that contractile system functions. And so we can tie up better use of percussion and high velocity percussion along with some safety and along with some better outcome techniques. And here's what I'm talking about. So if I use the TimTam on my leg, one of the first things that people understand is, hey, I'm just going to go in and attack an area that, again, that's painful or stiff. But what we want you to do when we're addressing muscular stiffness or a trigger point, which, by the way, is you can conceptualize as an area of your musculature that may be stiffer or have higher tensions or sensitivity than other areas. And so instead of an easy pull through the whole neuromuscular system, I have an area that may be like a knot in a piece of wood. And so when I tug on it, I don't get good function through the whole system. So when we begin to address these trigger points particularly, or stiffness within the muscle, one of the things that I can do easily to activate the brain to be part of the solution instead of just hammering away like a jackhammer on my soft tissue is that I can create a muscular contraction, high quad tension here in this case under the device or implement load. So what ends up happening now is as I TimTam myself, I can contract and I'll hold that contraction for 5 seconds and then I'll be able to release. If I can't come off tension quickly, it tells me maybe that the system isn't clear. I should be able to push on the tissue with pretty moderate pressure. And by the way, that's how we know if a tissue is normal or not. If I put some consistently moderate pressure into a tissue system, it should be painless. So if I push on something or I'm using percussion on something and it's painful, stop, you've just found a problem. So when I'm locate an area that's stiff or it's painful, again, I'm going to contract into the implement by making a muscle or creating resistance underneath that area. I'm going to hold that for 5 seconds and then I'm going to release like a light switch. And it's that release, that contraction and release that starts to break that trigger point cycle. Now, a couple other pieces on this. We want to make sure that you're keeping an eye on your breathing. And so when people are using the TimTam, oftentimes because we're so desensitized, right, because of the percussion, that sometimes we can take higher pressures. So how do I know if I'm going too deep? Well, if I can't take a full breath in or full breath out while I'm using the device, then you're clearly working too deep. So I should be able to easily breathe without that sort of fear, pain breathing, which looks like bears in the room, right? Something is attacking me. And this is another way of actually accessing our nervous system to have better outcomes with the device. So if I contract, I can hold my breath, resist, and then relax as I work on it. I'm going to make sure that I can take full breaths in and full breaths out. Those breathing is a way of me accessing my parasympathetic nervous system, which is a crucial component to changing dysfunctional contractile tissues like my muscles. So what ends up happening then is I get this sort of combined effect of being able to address a neuromuscular component to the features by contracting for 5 seconds and relaxing. The breathing makes the system work more efficiently. And it's my mnemonic to remember that I'm not working so deep that I can't breathe. Because if I can't take a full breath in and full breath out, I'm going too deep. Last idea here is that as I'm working on an area, most of the time we're going to feel like we want to attack that area. So I'm going to try to reperfuse an insertion or a localized area. But remember, we often say where the rats get in is not where they chew. And so this is a reminder to think constantly about working upstream and downstream. That if I'm having knee pain, stiffness in the calf, which is downstream of the knee, can be contributing. If I'm having knee pain, for example, stiffness or dysfunction or fascial tacking down of the quadriceps in any way could also cause that area to be painful. So don't just work on the area of the spot where it's painful. Make sure that you're thinking about freeing slack to that area by working upstream and downstream. Make sure you can breathe all the way in and all the way out. And if you're trying to address muscular problems, make sure that you're contracting and relaxing as you do it.